Good afternoon, everyone. I'm Joanne Starks of SEDL, or CEDL, in Austin, Texas, and I'll be moderating today's webcast on the work of the EPPI-Centre. The webcast is offered through the Center on Knowledge Translation for Disability and Rehabilitation Research, which is funded by the National Institute on Disability and Rehabilitation Research, or NIDR, in the U.S. Department of Education. I want to thank my colleague Ann Williams, our webinar administrator, for her logistical and technical support for today's webcast. A reminder that we will ask you to complete a brief evaluation at the end of today's webcast. I'll give more instructions following the presentation. And remember that you can download a copy of the PowerPoint file from the KTDRR's website at www.ktdrr.org and look for the webcast page. The Center on KTDRR is working with a number of national and international partners, and we are pleased to count the Evidence for Policy and Practice Information and Coordinating Center, or EPPI-Centre, among those partners. The EPPI-Centre is part of the Social Science Research Unit, SSRU, at the Institute of Education, University of London. Since 1993, the EPPI-Centre has been at the forefront of carrying out systematic reviews and developing review methods in social science and public policy. Today's webcast is the first of a series of webcasts presented by staff from the EPPI-Centre. It will describe how the EPPI-Centre got started, identify some benefits and problems of evidence-based policy, and discuss various types of research reviews that policymakers find most useful. Now I'd like to introduce our two presenters. Ann Oakley, PhD, is Professor of Sociology and Social Policy at the Institute of Education, and until January 2005 was founding director of the Social Science Research Unit, where she also headed the EPPI-Centre. She holds an honorary appointment as a fellow at Somerville College in Oxford. In 2011, the British Sociological Association gave her one of their first Lifetime Achievement Awards for her extraordinary contribution to the history of the development of sociology in Britain. She now works on research part-time, where her main interests are gender, health, methodology, and evidence-informed public policy. We also have today David Gough, PhD, who is Professor of Evidence-Informed Policy and Practice and the current director of the Social Science Research Unit and the EPPI-Centre. He is active with the Evidence-Informed Policy and Practice in Education in Europe and is a partner in the National Institute for Health and Care Excellence, or NICE, National Coordinating Center in Social Care, and the NICE Research Support Unit. His current research interests include systematic reviews, methods for research synthesis, meta-evaluation, knowledge production and use, research on research use, and research and citizenship. I'm now going to hand things over to Professor Ann Oakley to start today's presentation. Ann?
Thank you very much for that introduction, Joanne, and thank you for inviting me to take part in this webcast. I am down on our EPPI-Centre note paper these days as the founding director. I gave up being director 7 years ago, so that means that really I'm just a bit of history, and that's what I'm going to talk to you about. I'm going to say a little bit about the history of the EPPI-Centre, about where it came from and why, and then David will tell you more about the EPPI-Centre's work today. So, history is important. We need to know how things started and why, because that helps to explain why they are the way they are today. The EPPI-Centre started its work 20 years ago, and that was very much as a result of my conviction as a social scientist that sound evidence is important in all kinds of policy decisions. So on the next slide, we have 4 people whose visions of evidence-based policy all helped to inspire that conviction. So there are 2 women and 2 men. The first woman is Florence Nightingale. What most people know about Florence Nightingale is that she was the Lady of the Lamp, the person who pioneered a more scientific approach to nursing soldiers who were wounded in the Crimean War. But actually, Florence Nightingale was much more than that. She was a very able statistician. someone who saw very clearly that people who intervene in other people's lives need to be really sure that they're doing more harm than good. She complained about the habits of policymakers, which were to change the laws and introduce new policies without having the faintest idea whether they worked or not. Nightingale tried to endow a professorship at Oxford University in what was called at the time social physics, and the kinds of questions she wanted to answer included: how effective is school education? Does putting people in prison actually deter crime? Has the British domination of India improved social conditions there or not? She was a person who was very much ahead of her time. She asked these questions well over a century ago. The next person on the slide is Archie Cochrane. He was born rather later than Nightingale, in 1909 as compared with 1820, which explains why I knew Archie Cochrane, whereas I only wish I had known Florence Nightingale. Archie Cochrane was an epidemiologist with a medical background. Quite early on in his work, he was impressed by the fact that many medical treatments appeared to be based on poor quality evidence. He said doctors were failing their patients by not demanding the evidence of well-conducted trials and systematic reviews, and he argued that the same kind of approach was necessary across the whole public policy field. In 1993, he gave his name to the Cochrane collaboration, and this is the same year that we in the EPPI-Centre started our work. So the third figure on the previous slide is Ian Chalmers, and he is important to the next bit of the history. In 1978, Ian Chalmers headed a new research unit, the National Perinatal Epidemiology Unit in Oxford, which took up Archie Cochrane's challenge of building a database of randomized controlled trials and systematic reviews in perinatal medicine. And in 1979, I went to the National Perinatal Unit as its token social scientist. Being a token social scientist or a token consumer or a token woman are all quite difficult roles, but sometimes I think you can have an influence. Up until this point in my own professional life, I've been working mainly in the field of gender and maternity care. There I made the same kinds of observations as Ian Chalmers did, that perinatal healthcare seemed to be a good deal less scientific than it was supposed to be. For example, when I was doing some research in a maternity hospital in the mid-1970s, the junior doctors changed every 6 months, and when the new ones started, they came to me as the completely non-medical resident researcher to ask me what they were supposed to do. That is because the policies of the different consultants varied, and they didn't know what was the policy of the particular consultant under whom they were working. And I can remember being really shocked to discover that different doctors had different policies. It seemed to me that treatment of childbearing women ought to be a matter of evidence and not a matter of opinion. So working with Ian and other colleagues from other disciplines, I learnt some things that social scientists then were not taught, and I'm not sure whether they are taught today, things about the importance of well-designed experimental studies and about systematic reviews. In the early 1990s, it was very difficult to get funding for social science studies of this kind. Some of our colleagues in the social science field were quite hostile. They argued that social questions call for special methods and are not at all the same as medical questions, and I've always thought this a rather peculiar and quite arrogant argument. So enter the fourth character from history on my slide. This is a social scientist called Barbara Wootton, who I think is the person who really deserves the title of the mother of evidence-based policy. I knew her too. She led a long and extremely active life as an academic and a policy activist. Amongst other things, she was responsible for helping to introduce the welfare state in Britain, for the abolition of capital punishment, and for the invention of community service as an alternative to prison. Throughout her life, She was known for criticising experts in various fields for ignoring the need for evidence and doing instead simply what they wanted to do. Her most famous book, Social Science and Social Pathology, which was published in 1959, is a systematic review of everything that at the time was known about the causes and prevention of antisocial behaviour among young people. And the conclusions of her book upset many people, especially psychiatrists and social workers, as she found that most of their proclamations had no sound evidence base at all. One of her most famous observations, and I can remember being impressed by this at the time when I read it, was about gender. The remark that she made was that since most antisocial behaviour is committed by men, the courts would be idle and the prisons would be empty if men started to behave like women. Therefore, social scientists should study why women don't engage much in antisocial behaviour rather than why men do. And I'm not sure that anyone has yet taken up this challenge. So when the EPPI-Centre started in 1993, it was part of a new research unit, the Social Science Research Unit, here at the Institute of Education. We had very few resources, but we also had quite a lot of freedom to decide what we wanted to work on, provided we could get the money for it. And that was a big proviso. But the mood of the moment was gradually moving towards a new emphasis on the significance of evidence. By this time, government and the social science funding bodies in the UK were beginning to acknowledge the need for research resources that could support a more rational approach to policy development. I think the history of all of this is somewhat different in the USA, where there has been a stronger tradition of a rigorous social science being used to inform policy. The very first grant the EPPI-Centre got in 1993 was from the UK Economic and Social Research Council, and the title of the project was Establishing a Database of Interventions in Education and Social Welfare. I look back on this project now with a mixture of pride and embarrassment. Pride because we did what nobody else, at least in the UK, was then doing, and embarrassment because it was rather an amateur exercise. It depended on a lot of passion and dedication from a small number of individuals working very long hours. But it was this small grant that enabled us to develop the methodological framework of EPPI-Centre reviews, computer software, the standardised reviewing guidelines, and a system of keywording which form the basis of the approach still used today. This first project was followed by a series of commissioned systematic reviews in the area of health promotion. The first one, which is on this slide, was a systematic review funded by the Medical Research Council of behavioural interventions for HIV and AIDS. This was the time before modern methods of treatment, when behavioural interventions were seen as the strategy that was likely to hold the most promise. The MRC insisted that I visit the Centres for Disease Control in Atlanta to undertake this review, and I can remember going there on Halloween night when the epidemiologists were all dressed as ghosts, and that, I can tell you, was a truly frightening experience. The topics of the other first reviews are shown here: behavioural interventions for men who have sex with men, school-based sex education, young people's attitudes to smoking, health promotion programmes in the workplace, and strategies for preventing falls in older people. And if you compare these topics with the 6 most recently completed EPPI-Centre reviews, you'll see how far we've come. So the topics of the last 6 are a review of innovation grants for smallholder agricultural producers, interventions designed to strengthen NHS delivery in low and middle income countries, predictors assessment and outcome of cosmetic interventions, what young people think about obesity, body size, shape and weight, ways of improving the performance of either untrained or undertrained teachers in developing countries, and initiatives aimed at reducing sexual violence in conflict zones. This is a much wider spread of topics now than we had at the beginning. The EPICentre's review methods have also become much more sophisticated, with an ability to cover a more diverse set of methodological approaches, but David is going to tell you more about that. I want to use my last couple of minutes to reflect a bit on what the history of the EPICentre means. First of all, let's go back to two of the basic points about the evidence movement which inspired the EPICentre's work. Although systematic reviews of well-conducted research are most famous in healthcare, they also do have an established history in the public policy field. There are many examples of professionals in both healthcare and public policy doing what they thought was the right thing, but actually doing harm, or doing something that was simply ineffective. Here are three of my favourite examples. The first one is quoted quite widely by Ian Chalmers. The American paediatrician Benjamin Fox Baby and Childcare is read by millions of parents around the world. I read it myself when I was expecting my first child in 1967. One of the things Dr. Spock said in early editions of that book is that babies should be placed on their stomachs to sleep. So that's what I did. I put my babies to sleep face down. And then someone thought to look at this opinion about sleeping position, and it became clear that placing babies on their stomachs to sleep was responsible for tens of thousands of avoidable cot deaths. The second example from criminology is one that would have impressed Barbara Wooten. This is a systematic review of 9 randomized controlled trials of prison visitation programs for delinquent young people. And it found that when you introduced delinquent young people to real prisoners, they actually became more likely to continue their delinquent behaviour, although the programme developers thought this approach would have the opposite effect. The third example is one we encountered when doing our early sex education reviews here in the EPICentre. One approach to sex education that was popular in the USA is something called chastity education, which essentially is telling young people not to have sex. When we did a systematic review of sex education, we found that this approach had the opposite effect from the one intended for young men who were more likely to have sex after being told not to. The young women seem to have been a lot more sceptical and unaffected by the whole business, which is quite interesting. So finally, on the matter of challenges, resistances and impacts, the EPICentre has conducted, or helped to conduct, reviews of research right across health, education and welfare sectors. There's still, at least in Britain, a fairly strong divide between some social scientists who are suspicious of anything that reeks of something that they call positivism, and that's a term of abuse, not a compliment, and between other kinds of scientists who know that we need to believe in and measure and evaluate the real world in order to be sure of our efforts to improve public welfare. In the EPICentre, I think we have learnt to work with our friends and wait patiently for those who are critical to see the light. History shows that significant culture change can often take a very long time, but it really is happening in this area now. It's been wonderful to have a chance to develop the EPICentre's work and to collaborate with so many clever and dedicated colleagues. David is now going to give you a more up-to-date view of the results of this history in terms of what the EPICentre does today.
Thank you, Anne. So what Anne's talked about is the importance of us having a sound evidence base to make decisions on. Those could be policymakers, professional practitioners, or just all of us in our everyday life. So we're undertaking systematic reviews to have a formal, clear methodology for bringing together all the different research evidence and synthesizing it together, rather than cherry-picking individual bits of research which might support our prior biases, and thinking that things will work when maybe they don't. And maybe this is culture change, and that's why I like this image of people demonstrating for the better use of evidence in making decisions. The slide says after peer review, but when most people do systematic reviews, although the sentiment of peer review is good, normally the review process will include its own formal, explicit, systematic method of appraising the quality and relevance of each bit of research to answering the policy practice question that we're faced with. So knowing the impact, the effect of these different services, these different interventions, is really crucial. We need to know about those facts. But as well as knowing those facts, we need to know also about how those facts are understood and constructed. We need to make use of all types of research to help us understand what is known and to inform our decision making. And concepts allow us to have theories about how things change, to understand the mechanisms by which things change, rather than only black box, what we call black box research, where we're not quite sure why things happened, but we do know crucially the impact. So the impact plus the mechanism is particularly useful. So when we do systematic reviews, we can try to add together these facts from different studies. We call that aggregation, and find out what all of that information tells us, and that can allow us to test hypotheses. But those hypotheses will have been created by other types of research, which are using ideas, concepts, and we configure, we don't add those up in the same way that we may add up statistics, quantitative data. We interpret and arrange these different ideas. So when we're doing a systematic review, we may do a systematic review which is on the right-hand side of the graph, which is aggregating, pulling together, adding up the data, or we may do reviews which are trying to interpret and bring together different ways of understanding an issue or a problem. And those two approaches to primary research are reflected also in the approaches to secondary research, into the approaches of doing systematic reviews. The aggregative adding up tends to take a more a priori approach, and the conceptual synthesis tends to take a more iterative approach. And we can have exciting forms of review which may bring together the strengths of both this research information on facts and this research information on concepts. But the drivers for all the reviews that we and others undertake are the question that is being asked. If you ask a different question, you're going to use a different approach to your research, different approach to primary research, different approach to reviews of research. You're likely to include different types of data, and you'll come to different types of answer. So when people talk about systematic reviews, in the past we've assumed that they were just intervention reviews, what was reviews, aggregative reviews on their own. But now we have a richer variety of reviews. We have this richness of approaches in primary research, all of them providing useful tools for understanding the world. And now we're increasingly getting a rich array also of review methods using these different types of primary research. So reviews are not all the same. They differ in their question, they differ in their approach, and they also differ in how complicated they are. They may just be asking a very narrow question, black box review on impact, or they may be looking at a more complicated question with underlying theories examined in different parts of a review. And that may include looking at mechanisms, context, so you can have a multi-component or a mixed method review. So not only are the reviews that we're increasingly undertaking vary in question, approach, and their components, but they differ in how much they engage with an issue, how much depth they are. Are they taking a quite quick look at what's been undertaken, or are they looking at great detail at many aspects of a complicated issue? So reviews are also varying in how long they take. A lot of people recently have been advocating rapid reviews of evidence, and there are lots of advantages of things being done rapidly. You get an answer quickly, less resources are involved in the process, easier to fund, but they're likely to be of less depth or to be narrower than a more lengthy in-depth review. So it's not a question of there being a right or wrong method. It's like with all things, it's about fitness for purpose. What are you trying to understand? What resources do you have available to you? And therefore, what type of review do you do? And in the EPPI-Centre, we're terribly interested in developing methods for systematic review, and we usually manage that by undertaking different types of review, and increasingly they are ranging incredibly in the way we undertake them, because the nature of the question that we're being asked to do varies. So for some people that's worrying, but for us it's very exciting and interesting because we have this complex, rich array of resources to help in decision making for policymakers and practitioners. But so far I've just been talking about how do we bring together the research evidence that's been undertaken in a way that is useful. And the other side of this process is, well, what happens to this evidence once it is being produced? It doesn't in itself tell you what to do. You have to then go through further processes of interpreting and applying that knowledge. And to interpret the knowledge, you need to make the knowledge relevant to your local issues, which may or may not be the same as the people who've undertaken this review for you, or provided as a resource for everyone. You want to know how it relates to your context. Knowing about mechanism may assist in that, and there may be other types of knowledge, tacit knowledge, that you may want to bring into that process. But even when you have interpreted the knowledge and understand what it means, in order to make practical decisions implementing that interpreted knowledge, you have to go through further processes related to the realities on the ground. You might decide that a particular new way of doing things would be better, but you have buildings, you have colleagues, you have resources which may have been set up for another way of doing it, and moving from that way to a new way may not be straightforward and simple, and there might be a third way, and therefore there is a lot of interpretation that needs to be undertaken. Now, one way that this could be made easier is having more complicated reviews, as I mentioned earlier, but also to have the users, the people who are going to use the research, involved in the process of its production and its synthesis. And these issues of knowledge use have led the EPPI-Centre to develop a second strand to its work, a very related strand, about how do we use research knowledge. But there is this relationship between the production of knowledge on the left-hand side of this slide and the use of that knowledge, and that relationship is not simply one way. It's not simply evidence being produced, being synthesized, and then being pushed, product-driven, to be used by evidence. There is also a demand side to it, a pull side of it rather than a push side, and between those processes of production and evidence use there is forms of mediation that are going on, some of which may be well known and some of which may be hidden, and that different groups in society, different groups with different perspectives will need to be engaged, could be engaged in different parts of that process, the production side, the mediation side, and the use side. Now, we know pretty little about those processes at the moment. What we do know is that it's very important that the evidence that is produced, that the evidence that is synthesized, is communicated in a way that can be understood by people who might use it. But we also know that that is a necessary condition, but is not usually a sufficient condition. Well-packaged evidence in itself doesn't mean that it will be used. But trying to understand these processes of mediation means that we need to study them ourselves, and therefore the box at the bottom, research on evidence from production and use, is a new area of study for us in the EPPI-Centre. And the reason we are studying that is because we think it's an integral part of the process of relating synthesis to use. The reason why the Social Science Research Unit was started in the first place by Anne, and she can speak more to this than me, was to be an applied research unit to make a difference in people's lives. So in order to do that, we need the synthesis, but we also need to understand how to make best use of that synthesized knowledge, and then hence this new stream to the EPPI-Centre's work. So I'm just going to now give you some examples of the current work that we're doing in the two streams. So in terms of the stream in developing and applying methods of systematic review, our concern for methods is behind us creating a textbook, developing methodological papers, and developing tools for doing systematic reviews. We are involved in a large number of research projects, a few of which are listed here, and as I previously mentioned, the range, the diversity in these projects that we're involved in are what helps us to drive our methodological development. We're not answering the same questions over and over. We are faced with new challenges, and that helps us drive our new approaches. Those could be in public health, it can be in social care, crime, and international development. And we've also developed in-house, started by my colleague James Thomas, web-based software to help support the process of doing reviews, web-based software, and this has been designed for all types of reviews, so we can do statistical analysis, but also conceptual synthesis within the same software package. On the research use side, we've been involved with over 36 partners across Europe in trying to develop capacity in awareness and use of approaches to apply research evidence in education. And again, that's been a tremendously interesting and useful process because we've learned so much from our colleagues in other countries who have developed things in their own areas that have been useful for them, which we wouldn't have known about otherwise. For example, we didn't know that the Ministry of Education in Lithuania were putting energy into trying to make better use of research, and their approach is something that we could benefit from knowing about. My other colleagues here are involved in a Research Council, UK Research Council's projects about trying to increase the engagement of the public with research. Again, a two-way process between society, members of the public, in the communities, and universities and research. And we are also trying to develop a consultancy service working with people who think that research might be useful to them, but they're not quite sure how. And going and reading a systematic review, although interesting, isn't sufficient to mediate, jump this gap between the research world, the university world, and what might be useful to you, whether you're working in a health facility, a social care facility, or in a school. So that, again, is another very stimulating area for us to develop the work. And we also are engaged in providing training in this area. We have a master's course, we have a short course program, and we have commissioned short-term courses. So there's about 20 of us now in the EPPI-Centre, so that's quite a few people, and we're all doing many diverse things. And we'd be very pleased if you wanted to contact us and learn more. And you can also see more on our website here in the top left-hand corner of this slide. We've got this book on reviews. We are got a website on our European project, and we are also involved in journals like Evidence and Policy about making this link. So I hope that Anne and I have given you a brief overview about what interests us and what motivates us and what we do. And thank you very much for your attention.
Well, thank you so very much. This was a very interesting presentation about the history and purpose and activities of the EPPI-Centre. And I also want to thank everyone for participating in today's webcast. Before we wrap it up, I'd like to ask if either of our presenters has any final words for the audience today. Ann or David?
Well, I would just like to say that I found it very personally valuable to be updated on the EPPI-Centre's work, because I'm out of the mainstream now. And what I think is really impressive is how much of it is collaborative and how much of it involves networking. So what started out as really quite a limited national enterprise has really now become an international one.
I would like to echo that, and why we are so honoured to be invited to be part of this podcast with SCDL and KTDR, because these international contacts and relationships is how we're moving forward to face all of these complex issues about how to make best of use of research. So we really welcome and are grateful for this opportunity. Thank you very much.
Well, we want to thank you again for participating. We know that the EPPI-Centre has a lot of information to share, and there may be some people not that familiar with your work. We hope this will definitely help change that. And we're also looking forward to future sessions with EPPI-Centre staff. I think our next session will be focusing on the participation of users in reviews, as you mentioned, and then also our next session after that will be focusing more on working with policymakers and doing reviews with a policy focus. So I know that everyone will be glad to listen to those next webcasts. And as a reminder, today's webcast and the future webcasts will all be archived on the KTDRR's website. We also have a brief online evaluation form and would appreciate everyone's input about the webcast. The link is on the last page, as you can see here, of the PowerPoint file, and everyone who registers for the webcast will also get an email with a link to the evaluation form. So once again, a big thank you to our presenters today, Professor Ann Oakley and Professor David Gough of the EPPI-Centre, from the staff at the Center on KTDRR. We also appreciate the support from NIDR to carry out the webcast and other center activities. So on this final note, I will conclude today's webcast and invite you to participate in other events. Thank you.
Recording stopped.
Great job, everybody.
Yeah.